Evening, everyone. Again, thank you so much for attending this evening's event, Community Connect, Caring for the Caregiver. Thank you for taking the time out of your schedule this evening to come and learn about some resources and hopefully helpful information that will help you on your journey as a caregiver, or if you are doing this for someone that you know. Thank you so much for being a part of the caregiving community. I am one of those people. And I feel very fortunate to be at El Camino College because we have a platform to be able to offer information not only for students that are registered here, but also for the surrounding community. We're going to be doing more of these types of events. So if you would, we have a form in the back asking for your feedback. Any kind of topic that would be helpful to you, let us know what we can do to bring that information to you in this type of format. We have some really wonderful panelists, some experts on the topic of caregiving in the health field. And I am going to give each person an opportunity to introduce themselves. And then we will go from there with questions being asked of each of them. And then at the end, we will leave some time for you to ask some questions that you may have. I will come along with a microphone and ask you to speak in that microphone because we are also making this available to our audience on Zoom. So we're really trying to reach out to make sure everyone can be a part of it. And we'll need you to speak into the microphone so that they can hear what you're saying. Okay, wonderful. We will get started. First, I would like to introduce the president of El Camino College, President Brenda Timms. Wonderful. And now I'm going to ask for each panelist to go down the line and introduce themselves.
Hi there. I am Dr. Ujwala Diria. I am an internal medicine and palliative care physician, and I'm medical director of Torrance Memorial's palliative care program and hospice program. We provide pain and symptom management, referrals and resources, emotional and mental health support, and advice on discussing goals of care and advanced healthcare directives to patients and family members and caregivers with serious illnesses at our clinic, in our home program, in the hospital, and throughout the community with education events.
Hi, I'm Dr. Christina Moldavon, and I am a psychologist at Torrance Memorial Physician Network. And we currently have a behavioral health clinic in the network, and we see patients who are primarily referred by their primary care doctors. We typically see folks for short-term therapy. We treat anything from anxiety to depression. We treat a lot of patients who have caregiver stress. So I'm really grateful to be on this panel. Thank you.
Hi, and good evening. My name is Stephanie Rojas. I am a licensed clinical social worker. I also work for Torrance Memorial. I do home visits for the home-based palliative program. So I do a lot of short-term counseling and resource assistance. So lots of questions about resources as well. And El Camino is my alma mater. I was a transfer student here many moons ago, so it's nice to be back on the campus. Yeah, so thank you.
Hello, my name is Adrienne Braden, and I am a medical social worker with Kaiser's palliative care program. Stephanie kind of took a lot of the words out of my mouth. I assist with resource coordination, social emotional support. Under the program of palliative care, I also assist home health and hospice as well. So I'm happy to be here. El Camino is my alma mater as well. Got my AA, my B bachelor's, and then my master's. So this was a good starting point for me.
Well, thank you all for joining us this evening, and thank you all for joining us this evening. I'm Brenda, and I have the pleasure of serving as the president here, and you can see what wonderful work we do here because here are two of our alumni who are very successful and now giving back to their own community. So we appreciate having you all here. I am also joined tonight by two of my trustees, Trustee Kathy Mashler and Trustee Nilo Michelin. And before we get started, I want to thank Linda and her team for helping to organize this and to bring all of us together to talk about this very important topic. This is a new initiative for us. El Camino, we want to be more than just the place where you send your young sons, daughters, nieces, and nephews to go to college and get their feet wet. We want to be a resource for the whole community throughout the lifespan of our friends and neighbors who live in our communities with us. And so Linda came up with this amazing idea. Why don't we do some community connection types of events? And the first one that she launched last spring was starting your own business. And so we had lots of entrepreneurs and bankers here and had folks who were interested in starting their own business, and we made those connections. And then this fall we met and she said, I think we really need to do something about caregiving. And I said, you're absolutely right, because like Linda, I have a mother who has now reached a point where she can no longer live alone. And last year worked through that with my sisters. And so I appreciate her bringing this to us, and I appreciate our panelists. And so if you all are ready, let's just get right to it. All right. For all of you, what are the most common challenges caregivers face, both physically and emotionally, when caring for a loved one?
I guess I'll start. So first I have to say that I also have recently become a caregiver. My 82-year-old mother moved in with me on Saturday. And though she's been nearby, she transitioned from being a caregiver for my children as they grew up. And now that as they've gone off to college over the last several years, I've had to assist her more and more. And it's always surprising to me when she got to the next step of needing help. And so I think I come to this also from a personal point of view. And I realize through my work that caregivers are really the backbone of the healthcare for our elders and our seriously ill community members and people facing serious illness. And I think that actually is probably one of the challenges, the role creep, where you're really starting out, maybe making sure someone gets food and dinners, or helping them when they may be having a bad day and hurting a little bit, to slowly over time needing to be there every day, making it part of your routine. And you're not sure when that transition happened, where now more than half or 75% or even 100% of their care is in your hands. So that sort of gradual role creep kind of is exactly that. It's an expansion of a role that you never really thought of filling in that person's life. And it may happen very quickly if your loved one has a sudden illness or a diagnosis like cancer. It may happen gradually as people age. It may happen because of a fall and a hospitalization. And we're often unprepared for it, whether it happens slowly or suddenly. So I think that's one of the biggest challenges that I see facing our caregivers when they come to us. And and that leads to all the more serious things that happen when we're not prepared, right? We start taking things out of our lives to put more into their lives. And so, that's probably the biggest challenge that I see in our caregiver population.
The biggest challenge that I've seen working with folks who have caregiving duties is a lack of time. So, kind of like Dr. Deria was saying, over time, a lot of folks require more and more care. And so there's a lack of time to do self-care activities, to go to one's own appointments, to, engage in pleasant activities that have maybe kept them going through time. So time has been a really big thing. Lack of training and knowledge. So not really knowing what to do. Like, this person who I'm caring for is doing this and this. I don't know how to handle this. Or, I'm trying to get them extra help, but they're refusing it. I don't know what to do. So just lack of knowledge and training. They're not professionals, right? So what I've seen working with folks is just not knowing. And then also having poor boundaries. So feeling like I always need to be there for that person, right? So like I need to be there. I can't say no. Like I have to. I'm the only person there, right? So again, kind of coming back to that idea of time, not taking time for ourselves, as well as those are some, again, mostly issues related to time. Some mental health disorders and negative emotions that I've seen that are associated with caregiver stress as well. Higher rates of depression we see in these populations, suicidal thoughts, anxiety, feelings of loneliness as one's partner, if they're working with a partner or parent, starts to change, right? Sometimes folks' personalities change, especially if we're dealing with dementia or other issues that affect cognitive and personality functioning. So that can be really difficult. Grief is a big issue that comes up as well, as we're kind of losing this person who we knew to be our mom or our partner, or so it's a big grief process that comes with that as well. Feelings of loneliness, feeling kind of alone in this. I don't really have anybody who understands what I'm going through. So these are some of the common challenges that have come up.
Thank you. Well, I'll just add on to that. When you mentioned boundaries, what I'll add on to is I think there's the dual role when you're family and caregiver. You know, when you're caring for your mother and she's your mother, but you're also a caregiver, it can just bring up a lot of, family history. It's not like when you go to a 9-to-5 job and then you're off on Saturdays and Sundays and you don't have to answer your phone. It's just a very different dynamic when you're taking care of a loved one. I see a lot of overwhelm in the home visits that I do. The issue of not having enough time to take care of oneself. I know there's a lot, we all know how important self-care is. It's such a buzzword and it's such an important thing. I think that a lot of family caregivers, though, really struggle to fit that in. And how do they find a way to implement some self-care activities that work for them? That's a big challenge. And then money is another, that's a very common issue where if someone's taking care of a loved one and they need a break, just how do they pay for that? How do you fund that when it's so expensive? And there's not always a lot of assistance in helping to pay for care. So that's another issue I come across quite a bit. Thanks.
One of the issues that I come across is if the caregiver is living in the home with the person they're taking care of, a lot of times they tend to feel overwhelmed. But one of the things that I try to educate them on is mobilize a support system. If you have siblings, ask them to help support you, because just because you live in the home with the person you're caring for doesn't mean that you can't ask for help. A lot of them don't know how to ask for help. So that's one of the big challenges that I face, or that I'm actually helping the people I work with navigate, is mobilizing a support system.
Thank you. And one of the things that you all touched on is how caregivers often overlook their own needs, their own health. So Dr. Diria, tell us a little bit about what are some of the signs that we should watch for to ensure that we're taking care of ourselves.
So we talked about sort of the onset of sort of being unplanned and unprepared, and then overwhelmed as well. And so, there are three related conditions that come up that result in physical and emotional illness. So caregiver burnout being one of them, which is a deep feeling of exhaustion and stress during the care of another person. And then compassion fatigue, which is related to really taking on the trauma of a person in their care, in the care of the caregiver. And it causes sort of a lack of empathy and maybe emotional outbursts or negative feelings towards the person that they're caring for. And then that can be followed by a sense of guilt and shame, and I'm not doing enough. And then there's this really a trauma, a peri-traumatic experience where a person in your care, may have been in the intensive care unit, in the medical system, and the signs of of grief and helplessness and frustration within our health system actually affects the caregiver in a post-traumatic stress disorder type of way. It's not exactly the same thing, but it is very, very similar. So the symptoms that are pervasive in all of these disorders, so feelings of sadness, feelings of wanting to isolate, sleep excess, not being able to get to sleep, anxiety, panic attacks, that feeling of dread of not wanting to get up and doing the routine the next day. And when these become caregiver burnout, they can actually affect your physical health, the caregiver's physical health. So all of those things are associated with increased cardiac disease, so the onset of chest pain or increasing fatigue, inability to do as much work, chances of increased cancer yourself, neglecting your own appointments so that those symptoms are not treated. So worsening of a diabetic condition because you're not going to see your own physician and managing your own medications. Those are all signs and symptoms that we should be watching for. So if you as a caregiver I think the first sign is that sort of dread and not wanting to do the routine that you find yourself needing to do. It's time for you to reach out to your own physician, your own support system, your own people that can help you, because just like in the airplane where they say you need to put on your own oxygen mask before you take care of the person next to you, you've got to do that here. So any symptom that you normally would have reached out and gotten some help for, and you're tending to ignore it, is something that we really need to watch out for ourselves with.
Thank you. And so for our social workers, now that we know what to look for, when one is overwhelmed, sometimes one doesn't know where to start. So what types of resources are available, whether it's for emotional support or financial, or even just practical assistance for the caregivers?
Okay, one of the resources that I have is the USC Caregiver Resource Center, and they service. They actually will help you find a caregiver. They have support groups, counseling for the caregiver. Is there anything else I'm missing, Stephanie?
There's also in the South Bay, there's an organization called Independence at Home, and they offer the primary reason I refer to them is for caregivers. If you're taking care of someone who's over the age of 55, you can get free telephone counseling through Independence at Home, but you can't have your insurance through SCAN because it's SCAN Independence at Home. It's their non-insurance side, but that would be another one. And if if anyone would like that information after the panel discussion, I have the phone number and I'm happy to give it out to anyone who needs it. So that was another one in addition to the USC Family Caregiver Support Center.
And I also have a telephone number for that one as well.
And then Adrienne, we've already talked before the panel started. So we were already collaborating and sharing resources, and she's Kaiser and I'm Torrance Memorial. So just add to what I'm saying if I miss something. But in terms of dealing with overwhelm, there are a lot of good resources now that you can pay for, and then some that you don't have to pay for. So there's a big emphasis now on mind-body connection. So things like mindfulness, meditation. There are apps for that. There's the Calm app. There's Headspace. Those you pay for. There are also some really good things through UCLA. It's called UCLA Mindfulness, and they have a free app, which is really wonderful. Very well done, guided mindfulness exercises. They're generally under 10 minutes. And that you can just download that on your phone or even go to their website and listen to it from there. And they have these meditations available in, I think it's more than 15 languages. So and they're just very high quality. So just dealing with overwhelm, if there's just some type of activity, if we talk about self-care, sometimes it doesn't have to be something extensive, that can be helpful. For some people, blaring a song in the car, listening to it really loudly, like that helps to kind of alleviate some stress and maybe decrease some of the sense of overwhelm. For some people, it might be a 1 hour yoga class. For some people, it might be like a caregiver support group that you're doing online where you can feel less isolated and connect with others. But I think in terms of addressing overwhelm, it's a very personal thing because you have to really find what works for you. You know, for some people, it's taking a walk. For some people, that doesn't do it. They need I don't know, a jog, whatever. But you just have to find something where even if it's a couple of minutes a day, that can really make a difference in someone's stress level and help to kind of bring down that sense of overwhelm. And I think just reaching out and talking to other people in your situation and to maybe feel less isolated, you know, and if you have a support system, friends or family to talk to, that's great. But then if you don't, there are other ways like counseling or a caregiver support group.
There's one I want to add. So for someone taking care of a loved one that has Alzheimer's or dementia, there's an organization called Hilarity for Charity. It's a Seth Rogen's organization, and they have a program where they will allot 50 hours a quarter. They will pay 50 hours a quarter for caregiving support to give the person respite. So you guys can have respite. You know, if you want to go out on a Saturday or a Sunday, you know, they'll give you some hours to help relieve you. So you can apply for that, and they only, it goes by quarter. So you can only apply, like, I would say no more than twice a year. And the agency that they use is called Home Instead. So they have their own specific agency that they use for that purpose.
Thank you. And for Dr. Moldavana, they've already touched on some of the strategies that we can use to cope with stress, anxiety, and burnout. So anything else you want to add to that, as well as how do you encourage caregivers to set boundaries and to ask for help without feeling guilty?
Okay, good questions. Good questions. So yeah, a lot of that was already touched on. So I broke it down into like 4 categories. So the first one is just to ask for help. Friends, family, we've already talked about this, insurance benefits, meal delivery programs, all good stuff that you can learn about here. The friendship line is also a really good resource. If you're feeling that you're like your person's primary support system, giving them the friendship line, which is like a free hotline for older adults that they can just call and talk to somebody if they're feeling lonely. I think that's a really good resource and another way you can get some help and support. Training is really important. Lots of places offer free trainings. Torrance Memorial has a great training, and we've got a representative back there as well to talk a little bit more about the trainings that are available. So getting the training, getting the support groups, really learning emotion regulation strategies. So, you know, doing things that we enjoy, like Stephanie mentioned, like the yoga class, really getting that regular physical activity. There's actually been research showing that exercise can be just as beneficial as an antidepressant in some cases. And so really getting physical activity, whether that's, you know, dancing around the living room, and you can do this with your person, right? So a lot of these strategies, I would actually recommend trying with your care person, right? Maybe they're, you know, wheelchair bound, but maybe doing some kind of, you know, dance in there, or, you know, yeah, so getting them involved in some of these strategies, learning how to breathe properly, learning how to, there's a couple of different ways of breathing. A lot of us are chest breathers, so this can actually facilitate stress. So learning how to breathe more from our belly. There's a great video that UCLA has online on diaphragmatic breathing. So really learning how to breathe properly to regulate the stress response. This can be a simple skill that once we've learned it, we can practice it anywhere, anytime. It doesn't take any additional time. We just kind of have to make some efforts to remember. So maybe every time I get in the car, I check with myself and I say, how am I breathing? Am I breathing from my chest or from my belly, right? So that's something that very simply we can do, but reduce that cumulative stress over time to prevent everything that Dr. Deary was talking about earlier. So I think just learning how to breathe is so crucial. Practicing mindfulness, like Stephanie mentioned, there's a lot of great apps out there. UCLA Mindful is a great resource. Learning self-compassion, so learning how to be kind to ourselves in this time of stress. So often we put so many demands on ourselves to be perfect or do a good job and, feel guilty or shame or blame ourselves for not doing enough or not doing good enough. And so learning how to be kind to ourselves, there's a lot of great self-compassion strategies out there. And a researcher named Christina has a lot of great stuff on her website. Learning emotion regulation, learning to check in with your own emotions, how to take care of yourself. Sometimes if we're feeling really mad, maybe underneath that feeling are some other feelings, maybe some sadness, some hopelessness. So really learning to check in and cope with our feelings. And then setting boundaries. So the last one, so great. How do we set boundaries, right? Without feeling guilty. So we really have to remember, like Dr. Diria said, that in order to take care of other people, we have to take care of ourselves first. The oxygen mask, secure ours before we secure anybody else's. So it's so crucial to remember that, right? That it's going to be really hard for me to be there for this person if I cannot take care of myself, right? And remembering that we matter just as much as anybody else. And remembering too that boundaries are actually a display of love and compassion. So Brene Brown, she's this researcher who studied shame and boundaries. And I see some of you nodding, you may have heard about her. But she has this quote that says, the most loving people are the most boundaried. So knowing how to set limits, knowing to ask for what we need. It can be as simple as if you're, doing dual roles of working and being a caregiver, as when you come home and maybe your care person is like, hey, I just want to talk, or it can be as simple as just saying, hey, I just need a minute. I'd love to talk with you. I just kind of need a minute just to get myself together. So as soon as we get home, maybe just going to the bathroom, our own private little spot, and just taking some time, taking a few deep breaths as we transition to the role. But that can be a very simple boundary that can kind of help us take care of us so that we can be there for them. And the feelings of guilt, they may come. But that doesn't necessarily mean that we're doing anything wrong. So reminding ourselves that just because I feel bad doesn't mean that it is bad, right? And really knowing the difference between shame and guilt. So shame being more like I'm bad, guilt being more like I did something bad. So kind of trying to tease those two apart. And if there's some more shame-based feelings or feeling like we're undeserving or unworthy of time or taking care of ourselves, that might be something good to explore with a professional therapist. And it's okay to say no when needed. It's okay to change your mind, trying not to apologize too for setting our boundaries, for asking what we need, because again, we matter just as the person who we're caring for. We're just as important. And I'm sure if you ask them, right, would you want me to feel bad? They would probably say no. And so they want good things for us, just like we want good things for them. And so reminding ourselves of that and being kind to ourselves. Yeah.
Thank you. Dr. Diria, the other night I saw a commercial, and at the very end of it, what caught my attention was the gentleman said, we only have one body, so let's fight like heck for it. And what reminded me of that is when we're talking about all of these other stresses and anxiety and emotions that caregivers go through, that takes a physical toll. And those things manifest themselves differently in our bodies. So what are the most critical preventive health measures that you would recommend caregivers prioritize?
That's a really great question. So I neglected to mention one really big symptom when I first spoke, and that is chronic pain or even acute pain and injury to our bodies. We often hold those emotions, stresses, anxieties, sadness, loss of control in our physical bodies, and they often manifest as pain. And then I'll echo the most important thing you can do for yourself to prevent the onset of the physical symptoms is to take care of the burnout and the exhaustion and the stress itself. And when I counsel our patients in our palliative care clinic and talking to our patients and our caregivers together in the time that we spend together, I talk about taking care of your mental health and your health in three buckets. One is medication, which is kind of what we in our conventional medical system is sort of the out for that. The other one is sort of our community or face-to-face sort of work that we do. So that would include counseling with someone like Dr. Moldavon, and then our social workers, talking to support groups, doing the social interactions with your peers and friends and community, as you've always done, whether that's volunteering or going to school. As many of our caregivers are students, even here at El Camino, they are trying to take care of their parents, aging parents, and going to school at the same time. So you got to do that. That's the second bucket. And the third bucket has been mentioned. It's really mindfulness and relaxation and recreation. And what I want to say is for anxiety and chronic pain, it's been really shown in evidence-based medicine that mindfulness and relaxation are really two different activities. So on MRI scans, the pain centers respond to mindfulness activities differently than they respond to relaxation activities. And they really reduce the need for medications for pain. And I'm sure over time, as the studies continue to come out, this will be true for depression and anxiety and a lot of our mental health disorders, the post-traumatic stress disorders, all of those. So to prevent those from onset, I think learning the tools of actual mindfulness activities are really important. The way that I explain the difference is, if all of you are Dodgers fans, you've seen our batters do really well, and we're so excited for the World Series starting this Friday. But those guys practice, right? They don't bat 1,000. They bat 500. What do they bat? I don't know. What is a Shohei Ohtani bat? What's an average? Who knows that? 300s? It's 30%. Right? So when we think about meditating, I always said, oh, I can't do it. I'm distracted, right? It's about the swing. So if you're doing a mindfulness activity, you're going inside, whether that's with a guided meditation, breath work, and noticing your breathing, breath techniques. Maybe it's a musical or sound-based meditation, which you can get on apps and you can get classes, or you can do it sitting alone, but it's an inward, it's not an outward. So relaxation is outward, you're interacting or you're receiving. This is inward. And your mind will wander. So you're going to swing and you're going to bring it back. And half the time it's going to go back out. So 70% of the time, if you're a Shohei Ohtani meditator, it's going to go back out. But that 30% or that 20% or that 10% over time will increase. And that is what is beneficial to your brain cells and all of your neurotransmitters. And so keep swinging, learn a meditative practice. I prescribe 15 minutes twice a day. Now you're going to be able to do 2 or 3 at first. I'm 53. I've been trying to do this since my grandmother taught me when I was like 10, and I had never been able to do it. What I found for myself was sound meditation. And so that's what I practice now. I probably, the last 2 or 3 weeks with my mom moving in, I haven't done anything. So I'm going to not guilt myself about that. And I'm going to be compassionate and I'm going to be like, that's okay. But most of the time I can get out and do that 2 or 3 times a week. I try to get 3 hours in a week. So I would say probably your most important defense is to learn some kind of mindfulness meditation practice. That can be prayer. It can be sitting in a church. It can be sitting in your garden. It can be walking meditation in addition to your exercise. And exercise is important. And they'll tell you you need to get 10,000 steps or 150 minutes a weekend. But I think that it's actually probably just as important and probably more to do some sort of mindfulness meditation to maintain health in the face of the joy and the burden and the responsibility of caregiving.
Thank you. And I wasn't expecting that. I was expecting you to say exercise. So that's great information.
Well, everyone says exercise. The only ones that hear me say that over and over.
So back to our social workers. What advice would you give to caregivers who are balancing caregiving responsibilities with their own families and work?
I have something. Okay. So a lot has already been stated, but one of the things I wanted to touch on is recognizing burnout. And anyone that would like to take a screenshot of this, you're more than welcome to so that you can recognize the 12 stages of burnout. Recognizing the burnout is the first step to recovery. And then once you recognize what's going on with you, like someone mentioned earlier, compassion fatigue, feeling overwhelmed, then you can begin to address it. A lot of times we don't even know what's going on with us. And until you know what's going on with yourself, you don't really know how to do that. So then from there, I would recommend some of the other things that have been stated: relaxation, ask for help, even examine your expectations. You may want to change your environment. That could be scheduling a day for yourself, some me time. It could also involve just making sure you have adequate sleep and nutrition. Those are some of the things that you can start to do, because it starts with self, putting on your own oxygen mask first.
That was very helpful. Thank you, Adrienne. And I guess the one or two things I'll add is just, I think there's a reason why we're hearing more and more about just the idea, the concept, the practice of self-compassion, is because we need that as caregivers, and just may we be gentle with ourselves. And that can be really challenging. And if that's challenging for you and you're struggling with that, that could be a sign to reach out for some therapy or maybe a support group. But just that, being kind to yourself. We do so many shoulds. Caregivers do so many shoulds, right? There are all these expectations. I should be here. I should be doing this, as we're juggling and trying to balance. And I think, that those shoulds are something to take a look at. Where is that coming from? What do we deserve when we're working, or maybe we have kids that we're raising and we're also taking care of an elderly family member? Just that idea that we deserve to have peace ourselves. We deserve to take care of ourselves too, in addition to taking care of our loved ones. But that's very easy to say, and it's a very different thing to put into practice. So sometimes we just need some help with that. And that's where all these different tools that have been mentioned tonight, those come in. So.
Thank you. Dr. Moldavon, it was mentioned that we should reach out, but I think sometimes that's easier said than done when one is dealing with people at work, and we're caregivers, and some of us are dealing with children. We've got to go to the grocery store. Sometimes the last thing that someone might want is dealing with somebody else. So talk to us a little bit about how important it is to connect with a community of other caregivers for emotional support, and how to deal with feelings of isolation.
Well, thank you for saying that. Yeah, it makes sense that with all responsibilities, I've had this from patients as well. Like, on top of everything else I'm doing, how am I going to have time to go to a support group, right? So totally makes sense. So first, I just wanted to share about this study that was done at Harvard. It started in the 1930s, and it's called this Harvard Study of Adult Development, where they followed groups of 724 men across the lifespan. And the study actually continues to this day. It's the longest study ever done to this day. You may know about this. Yeah, and so what they found was actually that the number one predictor of a long, healthy life is to have positive social connections. And so they found that people who are most satisfied in their relationships at age 50 were the healthiest at age 80. So social support is the number one predictor. So being connected to others is going to be the thing, as well as everything that we've talked about, right? Super important. Meditation, right? Eating a Mediterranean diet. We haven't talked about diet yet. Physical activity, self-care, self-compassion, all that good stuff. But social support, number one, is what the studies research, right? Is what the research shows is like the predictor of good health. And so those connections are crucial. They're going to be our lifeline. This can be as simple as if there's no time to go to support group, maybe I call a friend who's going through the same thing, or maybe I go to the support group once, maybe I connect with one person there. I call them on my way to the grocery store and I vent, right? Like, can you believe this happened, right? But this can be kind of part of and again, self-care is going to look different for everybody. And for some people, they say, no, I just don't want to connect. I'm just going to look at some videos online and learn, and that's okay too. And again, it's going to be different strokes for different folks, but just I think knowing the importance of social support to health is good for folks to know just how much this feels like something extra, but how much I could actually get back from it, right? So the cost, okay, some time, but the benefits in this case are probably most likely going to outweigh the costs of time, right? So just kind of knowing that the cost benefit analysis is going to be high. There's a lot of benefits of support groups. Torrance Memorial has one, Alzheimer's LA, any foundation, cancer foundation is going to have one for that specific caregiver. There's a lot of benefits. There's emotional support. There can be expert resources and examples like this panel today. We feel increased confidence. So the research shows that caregivers who are most satisfied in their position feel better about themselves because they know what they're doing more. So going to a support group like this can help us to feel like we have a better sense of self-efficacy, which is this ability that we can do this. So we've got this. So it can make us feel better about the role. It can help us find the humor, get some laughs. We can have shared laughs with folks about kind of the common struggles and have some moments of positivity when it's so hard and things look so dark. They have guest speakers, research updates about the latest things. So maybe we find out about a new treatment that could help the person who I'm caring for. So maybe thinking of in terms as I'm not just doing this for me, but I'm doing this for the person I'm caring for as well, can be another way to try to make time for it. Like, oh, yes, this is part of my caregiving thing and for me. So, yeah.
Thank you. Back to our social workers. For those of us who are introverts, or maybe we haven't experienced a support group and we're not quite sure what to expect, what are some of the things that someone can expect when they go to a support group, and how can we help ease that transition?
Sure. Just add on as necessary, Adrienne. Well, if you're an introvert, so the main thing to just keep in mind about a support group is many people are nervous when it's their first time attending one. You might feel a little more comfortable just trying one virtually so that you can do it from the comfort of your own home, your own space. And also just that in a support group, no one's obligated to speak. I mean, those are generally part of the guidelines of running a support group is if you want to share, you can, but if you want to just listen, then you don't have to. And some people just feel more comfortable after the support group is done, just talking with people or even before the support group, just talking that way. And that's they're more comfortable sharing in that way rather than during the group. So I think that's what could work for someone who is introverted.
Okay. All right. So my last question before I give you all an opportunity to ask some things that might be on your mind, and this is probably one of the most difficult parts of becoming a caregiver, is we also become many physicians and many pharmacists. I know when we brought my mother home, the volume of medication, and it's like 13 sheets, and having to get one of those medical, the things that you put the medications in for the time of day and the days of the week. And it was just totally overwhelming, just that piece of it, and going to the pharmacy. So what are some things that caregivers can do to ensure proper communication with healthcare providers and pharmacists to avoid medication errors or other misunderstandings?
Such a great question. Thank you for bringing that up. Okay, so one, you have to be able to go to your appointments with your loved one that you're caring for. And you have to be able to ask the right questions. Part of what you should be asking for is a reduction in medications. The average senior has like 22 medications in their pill box. Probably half of those are causing more harm than good. Many of those may be repetitive. They may have been prescribed by one physician and not considered by another physician or nurse practitioner or PA in the office. All of our health systems and the other ones in this area have programs for people, meaning clinics with doctors like me. If your loved one has a serious illness, you can ask for a palliative care evaluation, and I will nix those medications one by one, and you may find that they don't need them. That's the first thing. There are transitional care programs from hospital to home. There are home health programs that will help you at home with nurses going through all your bottles. So ask for that assistance from your primary care physician or specialist that is taking care of the medical issues for your loved one. Okay, so the meds, a lot of them can be eliminated. The second one is to do the pill box for sure, so you're not burdened with remembering the times. Set alarms on your phone so you don't have to think about it 15 times of the day. Is there something there? Often a pharmacist can help you figure out which meds can go with other meds or can be taken together. Sometimes the warnings and the side effects are over sort of emphasized because we have to think about them. Lift that burden from yourself. Ask somebody else, is this really something I need to worry about? Because if you read everything on those pamphlets, it's going to seem like, well, okay, now I will see patients who their wife is giving them meds 8 or 10 times a day because, on the written, it can't be given with this, it can't be given with that. It can't be given 2 hours before or half an hour after a meal. Some of that is caution and some of that is absolute. And so you need somebody with an expertise to help you with that burden. Don't try to figure it out yourself. Okay. If you get prescribed a new medication, you should ask, these are the ones that I have, we have, is there anything I should really worry about, right? Keep a list or a pocket card. So when you go to every one of your physicians, they can take, or the physicians for those folks, you can have somebody else look at it and see if that's really the way it should be done. And the last thing, in reducing medications is really to think about the goals of your loved one's care. And in order to think about goals and values, you have to absolutely think about the future. And that thinking about the future and thinking about what the goal is something called an advance directive. And an advance directive is often thought about as a document that tells us what to do when we're dying. But I'm here to tell you that's not what it is. It's about defining your goals for that person's care right now and in the future. So then the other things, what procedures and diagnostic tests you want for that person. Do they go to the hospital? Do I call 911 or am I going to call my physician and get a home health nurse to come home? Do I need to be on these 22 medications or is 5 going to be enough? But you can't figure that out unless you have goals and values figured out with the person you're caring for while they can still help you make those decisions. So do that early. Write it down in a document, get the help you need to do that. At Torrance Memorial, on our palliative care clinic, for anyone, we will help you do an advanced care document as a 1-time or 2-time visit, even if you don't have a serious illness. If you're 65 and you need to figure this out for yourself or the person that you're caring for, make an appointment with us. And I'm sure that Kaiser has appointments like that or people that do that. Most of the health systems do. You can call us and make that, and we'll have that conversation with you, because you can't make decisions about medicines or anything else and taking care of yourself and what's important and what isn't unless you have that conversation with your loved one while they can still guide you. It reduces the trauma later on in their life, in your life, and it will help ease the burden of your care in the meantime.
I was just going to, one thing too, to add to what Dr. Deary was saying is to complete an advanced healthcare directive. The other really great thing is that they're free to do. You don't have to see an attorney. So you can either have the document notarized or witnessed by 2 people. So sometimes people are surprised to learn that there's actually, you can do it at no cost. Yeah. And you can find the templates online. If anyone wants to know where to find those online, let me know after as well, just to add that.
We recommend Prepare for Your Care, which is a University of California Regents document available online in like 20 languages with videos and ways to do it. Or you can come in and we'll give you one and we notarize for free in our clinic. So So I think they're back there as well. So we like that one because it's middle of the road. It's not a lot of stuff to write, but it's not just a checkbox either.
Thank you. Okay, you guys, I broke the ice, so now it's your turn. Any questions that you might want to ask our panelists?
Testing.
You mentioned that we can come to you to do paperwork and everything, but do you have to belong to what insurance?
Um, at, at our palliative care clinic at Torrance Memorial, we take Medicare, our own Torrance Memorial IPA, Medicare Advantage programs, most commercial insurance. If you don't know, you can just call us and we can check it.
Yeah, okay.
But what I'm saying, what I believe is that most of the Medicare Advantage programs will have something like that. For instance, the Optum has their own palliative care clinic, which could help you with something like that. So if you don't have something that we take, if you call your your loved one's insurer, they will probably have someone that they can refer you to.
Okay.
Thank you, sir. What advice do you have for when you're caring for someone who may not always agree with your decisions and pushes back quite a bit? How do you help us deal with that?
Who wants to answer that one? So let me ask for clarification. So you mean like you think something would be good and they don't want to go to the hospital or the ER or yeah. Okay.
Anything, really.
So one thing to remember is that you are a surrogate for them. And people, as they go through their lives and gain experience, see other people get sick, their friends might be sick, have passed. They may have seen a lot that maybe you haven't seen. And so part of your job as a caregiver, I believe, is to negotiate what is best for them, not necessarily in their safety, but in their will and their control over their own bodies and their own decisions. As long as they understand the consequences of it, it's sometimes helpful to look at it from their point of view. It's not always keeping someone as safe as possible, because then we'd wrap everyone in bubble wrap and put a helmet on them, and that's not going to happen, right? So there's always this feeling of guilt and responsibility if something, quote, bad happens. But if you've had the conversations along the way and you put yourself as a surrogate rather than a parent or a decision maker for them, as you're a surrogate for their point of view, it will be easier. But that is something that if you have a healthcare team that you've connected with can help you negotiate some of that. And again, take the burden off of you as a caregiver to just bear that on your own. Sometimes I will have to say to my patients and families, you know, Martha really wanted to be home and wanted to be as independent as possible. And I know that you don't feel like she's the safest, but it's okay. And it's okay. And there are things that we can maybe put into place that give us a little bit extra control over it, but we can't control it.
I just also wanted to add that it's so common. It's such a common thing, you know, when we go into home visits and, you know, an adult child may have an idea about what's best for their parent, and then the patient doesn't want that. They want something different. And I think we can all relate to how challenging it is when someone we love won't do what we would want them to do, what we would wish for them to do. And that might be the healthiest, right? Because people make a lot of choices for themselves, because if we're with it enough to make our own choices, you know, maybe we make some not so great choices. And so accepting that, that's a really tough one. That's a tough one. And so sometimes people do need support with that. You know, and then we go back to like a group or therapy. You know, if someone's having a lot of anxiety, for example, related to their dad, that their dad is just not making good choices, they won't accept a caregiver, they won't accept help, and they're worrying about their parent all the time, then that could be a sign that it's time to maybe just get some support with that and kind of dealing with one's own emotions. Like how can we be okay and keep our own peace when our loved one is maybe not making the greatest choices or not doing what we wish that they would do. So just to add that.
I think support groups help with that too, because what people will find in a support group is that you're not the only one dealing with this. This is very common, you know, whatever it is. Often it's, you know, I don't want to take this. I have too many medications and I don't want to take all of them. but well, you know what? There's 50 other people out there that are handling their mom's care and are also going through this. And so strategies, how to accept, how to maybe finagle some of that. I mean, there's, there are things that people that are your peers will tell you that a doctor won't. And we may not know some of those strategies. I mean, certainly 25 years into my practice, I know a lot more than I did when I was 5 years out, and I thought I knew everything when I was 5 years out. But if my patients had not, or my caregivers of my patients had not told me some of the little tricks and tips that they do with I wouldn't be where I am now with some of the things that I can tell. But I learned that from them. I didn't learn that in med school. So talk to your peers and figure out how to deal with that. Yes.
I was just going to make a comment. I caregived for my husband for 18 years. He had a traumatic brain injury. And one thing I learned over the years, to pay attention to what your friends and relatives tell you when they see him. Because for me, things were happening was so gradual that I just didn't see it over time. But when a friend would come over like once a month and say, "Oh, Kathy, I noticed he was doing blah, blah, blah now." Like, it didn't even dawn on me because it was so slow and so gradual over time. So one thing I did learn is pay attention. They're not trying to tell you what to do, your friends and relatives. They're just trying to voice what they're seeing. And that helped me go to the doctor and say, okay, this is what's happening now. For me, I didn't always see it. And also, you mentioned the list of meds. I kept it in my purse. I had 2 copies when I keep home, one in my purse, because there were those emergency visits to the hospital at the last minute where I didn't have to go looking for the paper. It was already in my purse. Or now I would take a picture of it with my phone because you need it like that. Or if the paramedics come to the house, to have it readily available. So I made sure I had a copy in my purse, or now I would actually put it on my phone. And that was extremely helpful when we ended up with those visits when your mind isn't working and you're driving crazy like to emergency room.
That's a great
Just a suggestion.
Yeah, you're the best medical record there is as a caregiver. The way that we communicate in our healthcare system is still really fragmented, and so you're really the source of truth for them. And that's again, it's a fail safe, and it can be a burden, but it's just the truth.
Hi, thank you. I have a question. When you do take, a break from a loved one, you maybe take a few hours for yourself, and they know you're leaving, and then they start getting that separation anxiety, and start kind of making you feel, well, what happened if I fall, or what happened, something happens while you're gone? Who's gonna, take care or assist me and they kind of want you around 24/7. And I was wondering if there's some sort of leeway to let them know, hey, I'll be back. I'm not leaving. But that, they start giving the guilt feelings that because you're wanting to spend some time, they feel like, again, a separation anxiety. So maybe you have some information.
One of the things I can suggest is it depends on what the person that you're going to leave can do for themselves. So let's just say if it's a person who is bedbound, I'm not so sure that it's even safe to leave them, because if there's an emergency, they can't help themselves. But if you have somebody who's mobile, I know, for instance, I know someone who, what they do is they prep the meals, they let them know. And this is a struggle. This is one of the things that I do counseling with every time I visit them, is the patient has a difficult time with allowing the son to do what he needs to do. And you just constantly reinforce that I'm going to be gone X amount of time. I have things that I have to do for myself, but this is how you can reach me. And then sometimes the person will leave the person alone if they know that it's like around their nap time. They will talk to them prior to their nap time and say, hey, while you're taking a nap, I'm gonna go run and do this really fast. So it's just about having the conversation, and just kind of reinforcing that you're still there and available, but you do need to take time out for yourself.
Yeah, I think that's a great idea is to, working on a plan for when you'll be gone. And then there's a question of, is it time to maybe consider, if someone can afford it or if someone has Medi-Cal and in-home supportive services, is it time to sort of get in place like a part-time caregiver that the person could get to know and trust so that it makes it easier for you to leave? And then Dr. Moldova had mentioned it's just that idea of there are a lot of feelings that come with being a caregiver for a loved one. And I think just to remember that if you feel, for example, guilt, that sometimes we have to sit with that and feel it, and that it's a feeling and it's okay. And that's part of where mindfulness comes in, being aware of our reaction, our emotional reaction to things, and then still to sit with that and then still go do what you need to do to take care of yourself, because that's really what helps you to keep going in the long term. So just to add that as well.
We have one last question.
I don't have a
Can I just say one
question.
thing about that? So one of the things that we don't realize that we do is to sort of pre-apologize, right? We apologize for leaving. We say, I'm sorry, I have to go. Rather than being joyful about going and doing the things that you need to do. So you maybe one of the things that can happen is sometimes we're getting off messages, not verbally, that our loved one is receiving, and it may be contributing to some of that anxiety. I'll tell you, when I do advanced directives with people and I say, well, what are the things that you don't want to go through if you were to get sicker? And more than pain, more than, not being able to breathe, they say, I don't want to burden my family. I mean, that's the number one thing I hear. And so, again, remember that this is someone who loves you. And maybe before all of this sort of happened, their decline, that is really what they wanted for you. And if you can get yourself to a place where you're leaving joyfully to do the things you need to do to love yourself and take care of yourself, some of that separation and anxiety may resolve itself.
I'm just speaking from experience. So it's really hard to leave and then come back, right? So I think it would really, for me, it helped a lot to put a camera where, like, I put my mom, or when she was more mobile, where she's stationed at, like, her room where she normally would, when she started deteriorating. It's more of a fall hazard. If she was going to fall, that's the likely place where she usually fell. So just having that camera there really made me feel better. And also, if she is, if the person that you're caring for is open to interacting, there are cameras that have voice that you can communicate with each other. I just don't use that with my mom because it startles her and it would cause her to make abrupt movements when she was more mobile. So that really helped because I'm working here at El Camino and I don't know what I'm coming to a lot of times when she started deteriorating, and I didn't know a lot of things. I was just playing catch up on things and doing a lot of research between medicine and care and everything else. You don't know, sometimes you're thinking like, gosh, am I going to be coming to somebody who's still breathing or not breathing or in between states? So having that camera just in key places really helped alleviate that.
Let's give all of our panelists a hand this evening. This has been a wonderful, wonderful event. I learned so much that I know I can immediately incorporate in my life, and I'm sure that is the case for our audience members too. Thank you so much, everyone, for coming. It's been meaningful for us. Please spread the word about these events that we're having. We plan to definitely have more. We appreciate your feedback, and so there are forms at the table there for you to give us some feedback on what we've been doing. We have food left over, so please help yourself with that. And I also just want to mention one last thing, because someone did have a question about getting actual training if they were interested in being a personal care aide. We have a free non-credit course here at El Camino for those individuals who would like to be employed as a personal care aide. But even if you're caring for a loved one, this might be something that is helpful for you when it comes to taking care of basic nursing skills, communication, home safety, all kinds of things. So check out El Camino. We have copies of this form right here at our outreach table in the corner with a number of other free courses for everyone here in the community. Thank you so much. And I have some gifts for our speakers.
Thank you all very, very much.